Good morning. My name is Michelle Driver. I am a registered nurse and a bachelor's student at Capella University. The purpose of this video is to reflect on my intervention presentation and capstone. The intervention for my patient with type 2 diabetes mellitus was centered on patient education regarding managing and controlling her diabetes. The World Health Organization WHO describes diabetes mellitus as a chronic metabolic condition marked by high glucose levels that, over time, cause damage to the heart, blood vessels, eyes, kidneys, and nerves. Galicia, Garcia, et al., 2020. Insulin resistance and relative insulin insufficiency mainly contribute to the development of type 2 diabetes. The Latino and African American communities are affected the most by T2DM based on their consumed foods. According to the CDC 2022, from 2001 to 2020, the prevalence of diabetes among individuals 18 and older in the United States grew considerably, with 11.3% of the U.S. population, or 37.3 million individuals, having diabetes. In addition, a staggering 8.5 million people with diabetes are undiagnosed and unaware of their conditions, CDC 2022. As a nurse, I must assist patients and treat their type 2 diabetes by continuous patient education, blood glucose monitoring, and helping them adhere to prescribed medications and dietary requirements. For this practicum, I chose to do my assessments on my diabetic patient, Mrs. FC. On June 18th, 19th, and 20th, I met with Mrs. FC for a total of 9.5 hours. I spent around 2 hours on each of the first 3 occasions and 3 hours on my final day presenting with the treatments for improving blood sugar control. The patient's teachings focused on diabetes, pathology, and risk factors. In addition, I provided information on ways to improve her health through blood glucose monitoring, pharmacological adherence, physical activity, and a healthy diet. Since the patient speaks Spanish, I utilize a translation technology called My Accessible Real-Time Trusted Interpreter, also known as the MARTI. The education brochure I provided was also translated to Spanish using a Microsoft translator. Intervention reflection. After discussing with Mrs. FC her health and the factors that put her at higher risk for complications, I devised an evidence-based plan to address her situation. I successfully implemented my lifestyle modification and metformin adherence to control and prevent hyperglycemia. I emphasized the importance of physical activity in lowering her blood glucose levels. I successfully executed my lifestyle modification and metformin adherence to control and avoid hyperglycemia. I emphasized the importance of physical activity in lowering her blood glucose level. The CDC 2022 affirms that proper blood sugar management can minimize the risk of eye, kidney, and nerve disease by 40%. Up to 85% of diabetes-related amputations could be avoided if healthcare services such as regular foot exams and patient education were provided, CDC 2022. Mrs. FC agreed to check out the senior fitness classes at the local gym. She stated that she would begin with 2 days per week of swim classes and see how that goes before increasing. She also took my recommendation to set phone reminders to ensure that she does not miss planned blood glucose monitoring and medication dosages, which can lead to medication non-adherence. The patient offered great feedback, stating it was helpful for her to have someone to take the time to explain things she did not believe were significant, such as missing a dose of her metformin or taking it only when she felt terrible. In addition, she reported that her healthcare team emphasized physical activity, but they never followed up on her compliance or explained how it would help her control her blood sugar. I believe my interventions benefited her health because she showed motivation to apply them to improve her health outcomes. use of evidence and peer-reviewed literature. During the research on type 2 diabetes mellitus, peer-reviewed literature and professional sources were used. The databases of the Capella University Library contained an abundance of research. I searched the internet databases using summons using the terms type 2 diabetes, Latino, Hispanic, and type 2 diabetes treatment. I checked that all selected articles had been published within 5 years and were peer-reviewed to confirm their relevance and credibility. Health technology. The use of technology was encouraged by educating the patient on blood glucose monitors and insulin pens. Management and treatment of type 2 diabetes are much more straightforward with technology. The American Diabetes Association has much information on ways technology has impacted diabetes management. One such technology is the insulin pen. A smart insulin pen is a reusable injectable pen equipped with an understandable smartphone application that can assist people with diabetes in managing insulin delivery more effectively. Devices and Technology 2022. The insulin pen takes the guesswork out of determining how much insulin is needed. Mrs. FC would benefit from the smart pen, is easy to use, and it is cost efficient. Another technology used to manage diabetes is a blood glucometer. Not all blood glucometers are created equal. Mrs. FC would need one that is easy to use with a big screen because of her poor vision. The top-rated glucometers cost over $1,000. 19 best glucometer meters for blood sugar monitoring, all you need to know 2022. Since Mrs. FC has poor vision, these two devices make it easier for her to see her blood glucose levels and how much insulin is safe to administer. Health policy implications. The Affordable Care Act was a primary health policy that affected Mrs. FC's care plan. The passage of the Affordable Care Act, ACA, in 2010 brought numerous changes to the U.S. healthcare system by allowing lower-income Americans, including many Hispanics, greater access to healthcare. Titus and Kaota Yakuri, 2020. The Affordable Care Act expands Medicaid coverage to include Americans with family incomes at or below 133% of the federal poverty guidelines, currently $30,657 for a family of 4. The expansion consists of adults without dependent children at home or who were previously ineligible in most states, the Affordable Care Act and Latinos 2022. Medication and doctor visits are costly, making it difficult for those without coverage to adhere to treatment. However, with the passage of the American Care Act, more Hispanics have access to health care, making it more likely for patients with chronic conditions like type 2 diabetes to manage their health. The American Care Act continues to help the Latino community, notably the elderly who live on limited incomes, afford health care. People with diabetes needs continuous medical treatment with doctor visits, insulin, and glucose monitoring. Even a week off from this medical regime could be detrimental to a patient's health. My patient is elderly and lives on a fixed income. With the provisions of the American Care Act, she can effectively manage her diabetes. Initial predictions versus projected outcomes. The initial prediction for Mrs. FC was that she would better understand blood glucose control. However, the results indicated that she was enthusiastic and prepared to begin interventions. In addition, she demonstrated a high level of interest with participation by asking questions about diet and physical activity and offering suggestions. Personal and professional growth. At the beginning of this assessment, I did not think I would be able to help Mrs. FC because there were many barriers present. First, the patient is Spanish speaking, so communication was a challenge. Second, as a new nurse, I felt uncomfortable using the Marty. I almost felt like the interpreter was judging me because of my inexperience as a nurse. I pushed my insecurities aside and focused on the patient. Mrs. FC was supportive and eager to learn, making me more motivated to teach. Once I started, I felt better knowing that my interventions were beneficial to the patient thanks to my effective teamwork with the patient. Third, I strengthened my research skills by utilizing Capella University's resources to obtain evidence-based literature to support my treatments. Finally, it was a fascinating experience to work on a project with a patient keen to participate and gain knowledge from my efforts. Throughout the RN-BSN program, I learned much about leadership and policies. I was able to apply these principles to my everyday practice. In addition, I furthered my knowledge of evidence-based research and how to find it utilizing the Capella University library databases. The instructors have helped me strengthen my writing and research skills with guidance and good feedback. The program has helped me grow as a nurse, and I will continue researching to improve my everyday practice. Thank you.